When we talk about the many faces of Chase Brexton, we mean that our patients are gay and straight, young and old, and may speak languages other than English. We may care for them at any place along their life journey.
The same spirit that attracted me to Chase Brexton many years ago now is still very alive today. The board of directors and our very talented and caring staff encourage you to join me in looking at the many faces of Chase Brexton. Over 10,000 patients from all walks of life now call Chase Brexton their healthcare home.
We have an incredible demand. It's a problem I think most people would love to have.
The kind of care that I have gotten and am still getting is wonderful.
This is a positive, healthy relationship, and it encourages them and it motivates them and it empowers them.
We just really see a wide variety of income levels, wide variety of backgrounds, a wide variety of experiences for patients.
So it's important for it to be long-lasting and for it to be here for the next 30 years and beyond.
Founded in 1978 as a gay health clinic, Chase Brexton Health Services has evolved from a grassroots organization into a multifaceted healthcare home for all who face barriers to accessing quality health care.
I gained far more by being on the Chase Brexton board and serving as its president than I ever possibly could have contributed back to the organization. Moving from an activist board that had really worked endless hours at the height of the AIDS crisis to more of an institutional board to help the institution grow and prosper on a long-term basis. I could have never expected, as a board member of the organization, needing to rely on it so heavily for the care of my children as I did.
I first became involved because my late partner Chris was HIV positive, and we were looking for all the different resources that were available to us. Chase Brexton jumped right out to us, and we were happy with our experience there.
Today, our patients have the ability to access a wide range of healthcare services that include adult medicine, pediatrics, dental services, mental health services, HIV consultation and medical care, and an in-house pharmacy.
Not only do we serve everyone in our community, but where else can you go and get your medical care, see your therapist, your psychiatrist, get your teeth cleaned, and get your prescriptions filled, all under one roof?
We recently celebrated 7 years of providing dental services to our community. We currently have just under 6,000 dental patients from all walks of life, all age groups, all ethnicities, but the largest component of our dental practice consists of low-income, uninsured individuals who would otherwise not be able to afford routine dental care. We try to instill in all of our patients the importance of prevention and comprehensive dental care, but in particular our pediatric patients. They are the future, and we certainly want them to grow up with the understanding that their teeth are meant to last them a lifetime.
We have a large immigrant population from all over the world: Africa, India, Eastern Europe, of course all of the Latin American countries. They're coming to us with a lot of problems. So, you know, a 20-minute visit for an immigrant patient who hasn't had any health care for quite a while is a lot different for somebody who, you know, is just coming because they moved to the area and want to switch doctors. Husband and wife couple who both saw me on the same day, you know, one with blood pressure, one with diabetes that was, you know, very much out of control. But the reason that their illnesses were so out of control had a lot to do with the situation at home. And being able to be a family doctor where we could see both of them really allowed me to kind of flush out what problems at home are contributing to their medical problems.
So we also have a behavioral medicine program, and this is actually a unique aspect of Chase Brexton, where we position health psychologists along with medical providers to meet the medical needs of patients. And we do this because most folks don't come to people like me when they have struggles. They go to their primary care doc. So we want to meet people where they are.
They develop a healthy relationship. For some of them, they haven't had healthy relationships. So this is a positive, healthy relationship, and it encourages them to want to take better care of themselves and improve their situation. So that makes me happier. I can honestly say I really enjoy working here, and I feel that what I do is valued.
Our goal is to provide our patients with access to all the services they may need through the care we can provide, or to connect them with our many partners that can assist them in other ways.
Great quality care that we have in America. We rank #1 on quality, but we don't rank first on availability. Chase Brexton ranks first in quality and first in opening its doors, and that's what our government needs to do so that every person in the United States has access to affordable quality health care.
Your support is essential as we hope to serve more patients, reaching out to our many communities in need of quality health care. Chase Brexton is about the promise of a healthier future, another day to be lived fully, and that life can get better.
It's a really load off of my mind and my children's mind to know that I have such a good health provider. They do not have to wear it, and I do not have to wear it.
But we get about 25 referrals for therapy and psychiatry services alone per week. We absolutely cannot keep up with the demand. So we need to hire staff and provide more services because our community is telling us they need it.
Paul and I have supported this organization with our time, our talents, and our money because of the great professionals that are involved with this organization, the volunteers, and it's sort of a legacy to friends and family that we've lost in the past. It's a way to remember them and to support the organization and make sure that others who fall in the same situation have health care that's provided to them regardless of their ability to pay.
We want to say thank you to our many volunteers, partners, and supporters for making 30 years of compassionate healthcare possible. Without you, there is no way we could be the healing hands that care for the patients that turn to us, the many faces of the women, men, and children who call Chase Brexton their healthcare home.